Hello my lovelies, and welcome to the first video of 2021. My name is Alya and I'm so glad you could stop by. So today we're going to be creating this eye look. I hope you love it, and because it's a new year, the first video of the year is about new things that can happen to your eyes. 10 types of things that can change or appear in your eye, and some of the conditions that might be causing them. So a bit of advice, a little bit of info. It was a bit of a long one, so I'm going to try and cut it down as much as I can. Hope you're having a great start to the year and you enjoy this video. I'm really excited about today's video because I feel like, although we're not going to go into too many details, it's a really good overview topic. So I'm going to start with probably the most common, or at least something that people would experience at some point or another in their life, and that is eye strain. The thing about eye strain is it's really hard to recognize sometimes. Sometimes it's really obvious, just your eyes are sore and you rest and it goes away and you kind of realize that it is eye strain. But sometimes it can lead to feelings like you have double vision, even though it's not really double vision, it's just blur. It can lead to headache, and that can get really confusing as to what's causing a headache. And it can lead to really sore muscular pain, so like a tension type situation. So, it's really complicated sometimes. So definitely if you're having a bit of a soreness behind the eyes or in the front of the head here, or you're feeling a little bit blurry, the logical first step would be to have some rest. Because at least that way you can conclude whether it was just fatigue or strain, or was it something a little bit more serious, in which case you can investigate further. Something else that's really common, and a lot of people do experience it at one point or another in their life, is red eyes. Red eyes are so common. I mean, at least in childhood you would get it, or perhaps later on in life, and sometimes it's just due to eye strain, which we just talked about. So red eyes are another puzzling one, because you can have a red eye for absolutely what feels like no reason. It's not necessarily conjunctivitis or an infection or an allergy of any sort. It's not necessarily dry eyes because they feel fine. They're not necessarily sore about it. Sometimes what happens is you just have a burst blood vessel in the eye, and you get this really big red eye, like somebody's sort of punched you in just the whites of your eye. And literally what that means is the conjunctiva, the part that can get pink eye or conjunctivitis or infection, underneath that is several layers of really juicy blood vessels. And normally we can't see them. Normally our eyes are quite white. But when that little tiny vessel bursts for whatever reason, because you gave it a rub, or because it was a little bit dry at some stage, or your blood pressure's gone up, or you've taken something that thins your blood, whatever the case, sometimes they do just pop. And it looks really super duper scary, because you can actually see what's normally a bruise under the skin and looks purple, then yellow, then eventually clears. In your eye, it's bright red, and then it goes kind of yellow tone, and then it goes away. So it's effectively just a bruise, but it's just very scary looking. But if it's giving you any discharge, or it's causing pain, or it's uncomfortable, or it's itchy, that's a big one, I would probably see the GP or the optometrist about it, because it may require some drops to treat it, and it could be actually an infection. If it's really sticky, the discharge, I would probably say you would need an antibiotic or something like that for that. But the minimum that I would do for any red eye is just give it a bit of a saline wash, because if it's just something in there irritating it and all you got to do is flush it out, you'll never know until you try. It's very hard to determine if there's an eyelash in there or just a bit of grit of some sort. You'll never know, because the eye is just so good at defending itself. It's just going to go to all these lengths to try and get rid of it itself. And all you need to do to help it along is just a nice little homemade saline wash. The next one I've got for you guys is not that common at all, and it's night blindness. Now, night blindness is a bit of a harsh term, because no one actually goes completely blind at night suddenly. There are people that have specifically night blindness, but there's a reason for it. It's usually a chronic reason. It's usually something that the ophthalmologist has to diagnose, that sort of thing. That's not the kind of night blindness that we're talking about here. What we're talking about is a progressive decrease in vision or visual acuity, so clarity of vision, when you're especially driving at night or when you're in a dark space. Now, this is not going to be something that suddenly comes on, because if it's very sudden, like yesterday you drove fine, you could see street signs under the street lamps and all that sort of thing, and today you can't, that's a different story. What we're talking about is gradually you've been finding night vision to be harder and harder, and then now it's become a real big problem for you where you don't feel confident driving. So if that's the kind of thing, and it doesn't matter what age you are, if that's the kind of thing you're experiencing, the first thing I would be looking at eliminating is changes to the cornea, or changes to your prescription in general, but specifically in the cornea, because that can cause a lot of glare and distortion in your night, especially nighttime vision, where the contrast is really difficult. You don't have much light, you don't get much information. The conditions are constantly changing depending on where the street lamps are and things like that. So it's a difficult situation for anyone to see in. And then if you have changes to the surface of your eye, or to your astigmatic part of your prescription, that can play a really, really difficult role. Another thing that can cause that sort of change is cataracts. And you can get cataracts quite early sometimes. Some people get them really young. So it'd be something to consider. You may also have some sort of inflammation or surface issue of the eye, like a dryness or a slight infection or a tear film dysfunction. That can also definitely change the way light falls into your eye. And another thing to consider is a vitamin A deficiency. Now, really super uncommon, I would say, in my practice. I've barely ever seen it, but it does definitely happen. And it's not that difficult, to be honest. It just depends on diet or other medication, and it definitely does occur. I just personally haven't seen it because I've been a little bit spoiled in my practice with what I see, but thankfully, at least my patients are doing all right. But it definitely can happen. And it's definitely something to consider, especially that you know that your patient is generally healthy and they're suddenly presenting with something that looks like a vitamin deficiency. It could be just that they changed their diet. It could be just that they're losing weight, or it could be just that they changed some sort of medication and that's affecting their tummy somehow. So it's just definitely something to consider as a clinician. And if this is a friend of yours telling you, so the first thing I would generally ask is, have you changed anything recently? I always ask my patients, have you changed your medication, your diet, your sleeping habits? Have you gone through any kind of stress lately? I want to know a little bit. I don't want to know too much, but I want to always know a little bit about their lifestyle changes, because often that can unlock a lot of clues about what my next line of questioning is going to be. And also it specifies when this patient or when this person is experiencing their particular symptoms. So you can actually find out a lot by just sort of asking a very general basic question. And change, if there is a change to your health or to your eyes, there's probably a change in your life altogether. So it's just something good to rule out, or at least know about if you're a concerned third party. Now, I brushed on this slightly just before, but diplopia. So diplopia is the correct term, or the proper term, for double vision. Double vision has to be with two eyes open. If you close one eye and it goes away, that was double vision. If it's still there when with one eye or the other eye, whatever the case, and it's not with two eyes open, it's only with one eye, that can be termed as monocular diplopia, but it's not a true diplopia. To have double vision, you need two eyes. Simple as that. And it's basically a disruption in your eyes working as a pair for whatever reason. Now, sometimes people get that from a condition that's only affecting one eye. That can definitely still happen, but you would really need your ophthalmologist or a clinician of some description to diagnose that. What you really want to know is which eye is causing your double vision, which is sometimes really hard to determine, but making sure that it is in fact happening just with the two eyes together. If it's only happening with one eye open, it's a whole different thing clinically. So if your condition is only one eye, let's start with that. Probably it's just a change to whatever eye is presenting the symptoms. So whatever eye is giving you that double vision. So if you close your left eye and it's still there, you know that it's your right eye. If you close your right eye and it's still there, you know it's your left eye. And if it's just one eye, the first thing I would do is a saline wash. Always start with a saline wash because you cannot make it worse with a saline wash. And the second thing I would do is lubricate. Again, can't make it worse by using a non-preservative or a preservative-free lubricant. Totally easy. Again, these are both very benign, over-the-counter, inexpensive ways to tackle it, and especially if you do it straight away, you're not losing any time to present to a clinician should it not improve. Okay, so if you try that for like a day, you're not losing anything. And if it's getting a little bit better but not going away, I would still see someone. I tend to be the kind of person that just sees someone, because if I don't know, I'd like someone to tell me, because I would want to know. But you know, if at least you've tried the first round of basic clinical advice, and that would be just to lubricate and clear it out and flush it out and all that sort of stuff. Just because when we as clinicians look in, we can see the cause, it doesn't change necessarily the method of attack. So if we see something in there that's causing dryness or whatever it is, we're still going to prescribe lubricants. So you may as well have tried it before you come in, and that way you've actually started your treatment sooner than often your practitioner can see you. So that's something good to keep in the bank. The next one I've got is uveitis. Anything with itis in it always sounds a little bit worrisome and scary. Itis just means inflammation. Conjunctivitis, yes, it's an infection, but it's just the name is coined from the inflammation that the infection causes, because the infection could be viral, it could be bacterial, or it could just be an allergy, and it's still called conjunctivitis. Here, uveitis is an inflammation of a body that sits sort of next to the iris called the uvea. And the uvea controls quite a few things. The iris is one of them. And sometimes you can have just an anterior uveitis where it's actually iritis, or inflammation of just the iris alone. But often it affects quite a few sections of the uvea because it's inflammation. It tends to be a bit more spread out. Now, uveitis can be very painful, but almost all the patients I see with uveitis have one symptom chronically, consistently in common, and that is extreme sensitivity to light. I'm talking like sitting in sunglasses with one eye covered like this and still quite intensely sensitive to the light. So, and that's because the uvea is responsible for our pupil. So when the pupil can't control itself automatically, that's going to create quite a bit of distortion and sensitivity to that space. It's also a little bit painful. Even though not all patients report pain with uveitis, they're all uncomfortable at the very least. So it's more of a pain threshold thing or a sensitivity thing. It's the kind of thing you don't want to wait on. You definitely want to see at least a family doctor, but you definitely want to see an ophthalmologist at some stage, because they're going to need to prescribe you two very, very, not that they're unsafe, but they're drugs that we keep for very specific things, because you don't want to be handing them out, prescribing them willy-nilly. So if you have an emergency department next to you where there is an eye registrar there, better. If all you can do is see your general practitioner, fine. If you can at least get to an optometrist that's quite knowledgeable, you know, that's your middle ground. I would still want a doctor on this one, but that's Australia too. Where you're living, it could be a little bit different. So the drugs that they would prescribe in this situation is a dilating drug that actually knocks out the function of the uvea, so it lets it stop working for a while so that it can recover. It also stops the iris from sticking to anything because it's so inflamed it can actually stick to other parts of the anatomy. So that's the dilating one. And the other thing that they give is a steroid. So a steroid is something that's going to decrease that inflammation, that swelling. There is definitely treatment options for people who can't have steroids as well, but typically that's going to be your go-to as a clinician. That's what you're going to prescribe. So if you're experiencing really extreme light sensitivity, a little bit of pain, distortion in vision, one lady I had actually could see the bottom line, but she would normally be wearing glasses to see it, so we knew that that iris muscle was not working terribly well. Plus the eye tends to go red. It doesn't always, but there is a tendency for a red eye response as well. So, but yes, definitely with the sensitivity of light that's not going away, it might even get worse as time goes on. And this is something you'd want to be presenting with quite early in the piece. So you've tried your saline, you've tried your lubricant, it's been, 4 or 5 hours, nothing's really changing, see someone immediately. In fact, call someone first, and then by the time they see you, you've at least tried that part. Okay, another one I would not wait on, another really, really big biggie, is flashes and floaters. So flashes and floaters are symptoms of two conditions, one of which is completely safe and not a big deal and everyone will eventually go through. And the other one is really, really dangerous, really, really emergency, and you could potentially lose your eye forever. Not just your sight, but potentially your eye. It doesn't really happen anymore with today's kind of surgical advances, but it's a potential thing. So to save your sight, if you have flashes or floaters, you want to be going to someone who can look at the back of your eye. Don't care who they are, which professional it is. It has to be someone who has a device that can look through your pupil and see your retina. Your retina is that beautiful, extremely intricate piece of tissue that sits at the back of your eye that actually covers the whole back section of your eye. And that is where all your nerves, all your receptors, all your vessels for sight exist. Those vessels receive light and then send it down the nerve all the way to the back of the head where vision occurs. Without that body of tissue, no sight can possibly happen. So you want to do everything in your power to protect those cells if you're getting flashes and floaters. So a flash would be defined like an on-off kind of sensation. It's a bit like, when you're sitting in the lounge room at night and a car drives past your window and it's just that lights were there and then they're gone kind of thing. It typically occurs out far in the periphery. It can be really high, really low, really right, really left. It's quite short-lived. Some people describe sort of sparkles or kind of prismatic kind of effect to it, but it's definitely bright and it sort of doesn't last long. Some people also report a crescent shape, like a moon shape, or a horseshoe shape. In the flash, it doesn't necessarily have to be a line, and some people have reported like a lightning bolt. Everyone sees it a little bit differently. I think a lot of it is actually how the brain perceives it, rather than how the eye experiences it, but it's really irrelevant. What needs to be ruled out is a retinal detachment. That means that retina, that beautiful tissue I just spoke about, is quite a significant chance that tissue is actually tearing and coming off. So scary stuff. Most of the people who I see with flashes and floaters, their retina's not going anywhere. Most of the people I see with retinal tears or partial detachments didn't get these symptoms. So it's not an all or nothing. But if you are seeing flashes and floaters, and more importantly, if it comes to be a veil over your vision, run like mad to the emergency department. That is a serious situation you're in. But if it's just flashes and floaters, they're short-lived, you're not really getting too much more, I'd be quite concerned and try to be seen quite quickly, like within 24 hours, somewhere by someone, just to rule out any kind of permanent damage happening. Floaters, on the other hand, can be quite chronic and can be quite innocent. The other condition that all of this is kind of indicative of is one called PVD, posterior vitreal detachment, and I do have a video on it. It's basically a detachment too, but of the vitreous, of the jelly inside the eye. Now, nowhere near as scary, nowhere near as dangerous, and completely benign. A lot of people can have a jelly detachment and have absolutely no consequence whatsoever, but it is something that you want to be aware of, because once the jellies come off, there is still a chance that the retina can tear. And the other thing is you can develop other retinal surface issues as a result of that jelly detachment. Just depends on how it's coming off, and then we're starting to get into the mechanics of it, so definitely more details in that PVD video. But it's just something that you want to be ruling out early in the piece. You don't really want to be living with the knowledge that your retina might be tearing. You kind of want to rule it out, and this is something you don't want to leave. You know, you don't want to sort of go, oh well, if it tears, it tears. No, buddy. There's not much time to act on a torn retina. You kind of want to have it lasered really, really early in the piece if that's possible. And if you can't have it lasered, it is a full-on eye surgery, and it leads to all kinds of side effects and consequences, which you then eventually go away from quite scot-free. But most people do quite well after retinal reattachment surgery or that sort of stuff, but it's such a high risk and such a complex and such a detailed surgery. You'd kind of want to avoid having it if you could. Having said that, if you're watching this and you're about to have retinal reattachment surgery, don't be worried. The skills of the surgeons who do this type of surgery is just gobsmacking. Honestly, I have no words. I'm a talker and I have no words for the kind of skill that this requires and that they do have. So you're in good hands. It's just that if you could have avoided it, it would have been better to do so. And even your surgeon will probably tell you that. The next thing you want to rule out, especially if you're getting eye pain, is glaucoma. I think that anyone over 40, 45 needs to be having regular eye checks, which include a pressure check. It doesn't necessarily give you a clear yes or no on glaucoma, but if you have a family history, I think every 2 years is a really safe bet just to have a quick check and have someone have a look at the back of your eye. With retinal disease, often you'll get symptoms really early in the piece. Unlike glaucoma, retinal disease is very symptomatic. Glaucoma has practically no symptoms. It used to be known as the silent cause of blindness. I think that with countries like Australia, where we do encourage regular free eye checks for everyone, it's less missed these days. But there are still cases, I've seen them myself, where people are just scared or worried or just avoiding whatever it is that they're avoiding, and I've seen people still go blind from glaucoma and be completely unaware of the fact that they've just done that to themselves, just by not coming to a regular eye check, knowing full well that they're high risk, you know, things like that. It does happen. But the facilities, the availability of eye care is there in places like where I live. And I believe that this should be possible everywhere. It's just a matter of access. So sometimes you're just in a rural area or something like that, but I believe that the care is there. It's just a matter of getting to it. If you are suddenly getting patches in your vision, like a spot that just moves with you, especially if it's like a grey spot and it's really interrupting you, especially for close-up vision, you're probably looking at a retinal disease, especially a macular disease. These things are often related to diet, or sometimes they're just genetic and chronic, and they're just something you want to be seen by a specialist for, or at least an eye care professional of some sort for. But these things are more commonly something chronic. They're not usually something sudden. However, you can sometimes get a sudden loss of vision due to a vein or an artery doing something incorrect, or sometimes as a consequence of diabetes. And I've met people who didn't even know that they were diabetic until something happened to their eyes. So eyes are sometimes the first point of call for diagnosing diabetes for some people. So I mentioned eye pain just briefly. Again, just going to say the same thing again. If you're having eye pain, try a saline flush or wash first. Try lubricants. If it's persisting, you may be having some corneal ulcers or some kind of eye pressure change or something that needs a little bit more attention. But if you've at least tried to flush it out and tried to lubricate it with a preservative-free lubricant, that's your first port of call. And at least you've ruled out the potential of it being something quite innocent. And also, if you know that lubricants are helping you, but they're short-lived, it could still be a corneal scratch or ulcer, because lubricants will definitely improve the symptoms there. They just won't fully cure it. And last but not least, lids. So sometimes we get these styes or these lesions or these little growths on our lids or on our eyelashes. And for that, it's a very, very interesting thing. For that, you need to kind of decide how chronic it is. If it's just popped up suddenly, you probably can be assured that it's an infection, and you want to put heat on it, and it'll probably come down. You want to give it a soft massage. There's a whole video on it on this channel if you want to see if you do have a stye or a chalazion. But they can be painful, and they can be really, really disruptive and a bit unsightly. But if you've had a lesion that's kind of popped up and then it kind of went down and then it kind of changed color and then it kind of grew and then it maybe didn't change color, maybe it just grew, or maybe it's just sitting there and not doing anything, I would sincerely want to know whether that's a BCC or a basal cell carcinoma, or even it could be a SCC, a squamous cell carcinoma, or it even might be a melanoma. So these are all types of cancers that can happen on the skin, and the eye, because it's so thin and fine and a bit sensitive and very exposed to the sun. You never put a t-shirt on your face, right? Like you do the rest of your body. You have sort of this extreme exposure there. Unless you're someone who wears a hat and sunglasses all the time, there is a good chance that at some point in our lives we might be at risk of developing these type of lesions. So if that's the case, then you want to be able to present at least to your general doctor to make sure that you're not dealing with something that's going to cause a lot of damage to the eye, because they have to cut out these things, and if they get really, really big, they have to cut out a really large portion of the eyelid. So if you can catch them when they're tiny, they won't cause too much deformation to the eye. A lot of people just look and can function completely normally. The eyes don't change at all after surgery in the hands of a good plastic ophthalmologist. But if it gets really big and they have to take out a really large section of the lid, you have to do grafts and transplants and things like that, and it's a little bit more involved. And when you have to reconstruct an eye, it never really feels like it used to. It might look pretty good, but it will never sort of be the original eye anymore, because the tissue that they'll transplant will be different to the original eye tissue. So something to consider: lesions you don't want to leave too long, especially if they're small. It's a good time to have them at least biopsied, or preferably removed. Don't try and do it yourself. These things often, this is like a tip of the iceberg. The actual carcinoma or the actual lesion is actually really deep inside. What you see on the surface is just a little tip. So you definitely want somebody who is skilled at eye lesion removal to do something about it. Not a plastic surgeon, not a general practitioner. You would probably want a proper eye plastic surgeon for that. Okay, so that is, all right, so I haven't mentioned everything because this video is getting super duper long, but I hope you like the eye look. You'll see the full look in the intro, so that's okay. I hope that wherever you are around the world, my lovelies, you're doing so super well. Please do subscribe. If you like this video, head over to Instagram for more bits and pieces, and I can't wait to see you all year on this channel. Bye.